Well, I just wanted to begin by welcoming everyone to the 5th session in a series of social service workforce strengthening webinars that are funded by PEPFAR and implemented under the auspices of the Social Service Workforce Strengthening Alliance by our USAID partner Capacity Plus. This session will focus on case management and particularly how case management might be appropriate for strengthening social service workforce and systems of care and providing better coordination of services for vulnerable children. Today's session will feature presentations by Andy Bilson, who's the professor of social work at the University of Central Lancashire in the UK, and he's going to discuss a recent paper that he authored on what makes social work work. We're also joined by Keetie, Rowland from the Center for Social Protection at the Institute for Development Studies, also in the UK. And she'll discuss preliminary findings from a study that's focusing on case management in sub-Saharan Africa. And finally, Herman, a senior practice associate at the National Association for Social Workers here in the United States, will talk with us about case management models and guidelines in the U.S. This session will be chaired by Amy Bess, Herman's colleague at NASW, and who should be very well known to you. She is also currently a senior practice associate for human rights and international affairs at the National Association for Social Workers in the United States. But as of next Monday, she will begin a new position as coordinator of our newly formed Social Service Workforce Strengthening Alliance that you've heard us talk about many times during these webinars. So we're very, very excited to welcome her in her current capacity today and next week in her new capacity. Before we begin, I wanted to give Chris Horvath another opportunity to just walk us through a few important features of the Illuminate technology for those of you who are just joining us now for the first time or who are unfamiliar with a few of the new updates. Chris, are there any last-minute instructions you'd like to give us?
I don't think so, other than I think, again, mentioning, perhaps reviewing that I understand that we will be using the polling feature a couple of times during the session. So I just wanted to return us to this slide here where I'm highlighting the polling button. So this polling button currently is showing the yes/no options, but later on we might see additional options for the poll depending on the question. So I just wanted to highlight that bit. Thank you.
For your very thorough webinar briefing that you gave us prior to beginning this session. You're always very thorough and very knowledgeable about Illuminate. We appreciate that. As noted, this is the 5th session in our series. We launched this webinar series last July with a session on lessons learned from the global healthcare workforce. This was followed by another webinar in September on social service workforce training curricula, a third webinar in November which reviewed our accomplishments in the field of social service workforce strengthening since our conference in Cape Town in 2010. And our most recent webinar was in January. It focused on community-based social service workers and was conducted in both French and English. Just to let you know, this webinar today will be conducted in English. Unfortunately, we're not going to be able to do a French version of this webinar today. But we are very pleased that that some of our French colleagues are joining us today, and very pleased that all of our sessions so far have been very well attended. And the summaries, just to remind you, the summaries, the PowerPoints, and a recording from each of the sessions, including our French session, can be found on ovcsupport.net, where we will also post information about this session and future sessions. For those of you who are unfamiliar with ovcsupport.net, please note that the website includes a range of resources. We're adding to those resources every day. We're including information on how to engage in social service workforce strengthening initiatives, as well as more general information on programming for vulnerable children. Unfortunately, these resources are almost exclusively in English. This webinar, as I said, will only be held in English. However, we are eager to increase the number of documents posted in other languages. So if you have additional resources that you would like to share in English or in any other languages, please send them to ovcsupport.net@msh.org. At this point, I'm going to hand the floor to Jim McCaffrey, Deputy Director of Capacity Plus, who will begin this webinar with a short poll.
Thank you, Maureen. What we're going to do is to ask you 3 questions just to get us started. And we recognize that, we want you just to give your kind of first response or best response, not worry too much about definitions at the moment. And then some of this we will be discussing more in depth as we go along. But we're just trying to get an initial sense of who's in the room, so to speak, who's in the electronic room, the global room that we're in. So the first question is, are you currently associated with a program that is using a case management approach? And this is a yes/no question. So if you could go to the icon, and go ahead and put in a yes or no. Where'd it go? Okay, so if you could go, we've got, it looks like 12 yeses so far, and 11 no's. Okay. Okay, any other last ones? It seems like sort of 12 have answered, 13 I guess have answered yes, 14 no. So that was one question. We'd like to go on to another question. This is one that has a different kind of response. If yes, who is responsible for carrying out case management activities? A trained social worker, diploma or degree holder, B, community worker or a parasocial worker, C, a non-social worker, a mix of the above. So let me get that polling type question. That's A through D. So again, if you could go and push A, B, C, or D, for those of you who could do that. So none. So as we're moving here, A and B. So we have a few responses with the trained social worker, a few more with the community worker, but by and large, D is a mix of the above. So some combination. Okay, we'll try one last one here. Again, using the same one, approximately how many families does each case manager work with at a given time? 0 to 50, 51 to 100, 101 to 200, and 200 plus. The same polling type, multiple choice. Okay, it gives us some rough idea. I mean, basically what I think we're drawing from this is that either we're all meaning some different things by what case management means, or most of us are not yet either doing it or seeing ourselves doing it. So that would be kind of an important lesson as we go through this. So it might be kind of interesting to think about these questions at the end of this session also. In the meantime, thank you for doing this, and we'll kind of take this as a kind of an introduction, and then we'll hand this over to Amy.
Okay, thank you, Maury and Jim, and thanks, Jim, for testing out those polling questions and kind of warming everyone up to this topic. And good morning or afternoon or maybe even evening, depending on where you're joining us from today. As Maury mentioned, today's webinar is on casework and case management in social service settings. I'll say a bit about how this topic was chosen and give a brief overview of the issues that our three fantastic presenters today will be discussing. As I'm sure many of you are aware, these webinars are being carried out as a result of the Conference on Strengthening the Social Service Workforce that was held in Cape Town in November 2010. As Maury mentioned, the topics that past webinars have covered, such as the role of community-level workers or health system strengthening, have touched on this issue of case management. It's become a so-called buzzword, and yet there are many differing opinions and definitions of it. At the same time, it can be one of the most basic ways of coordinating services to families. In this webinar today, we hope to highlight how case management is being used in a variety of settings while recognizing a few key points. First, many agree that one of the goals of case management is to integrate services across health and social service delivery systems that are often quite fragmented or siloed. Children and families often face a multitude of needs that span different sectors, whether it's health or education or protection or providing cash transfers or housing and so on. For example, a parasocial worker may learn about an elderly woman with extreme health care issues who's in need of hospice or palliative care. She may also learn that the woman is heading a household of her 3 grandchildren who are not enrolled in school. Case management systems can help to create coordinated systems of care, and the case manager would link this person and her family members to available services across different sectors. Second, the way in which people apply a case management approach must be tailored to the local setting. The hope is that it entails a strengths-based needs assessment and that families are actively engaged as partners in developing plans and identifying needed services. And then the process that I just mentioned of coordinating services through an established referral system is often one of the most challenging steps in settings with few or unavailable services. It also requires a significant level of harmonization and collaboration between NGOs, government agencies, and communities. The involvement of community-level actors, such as child protection committees or other community members, is also important and will be addressed by our speakers today. So the way in which it's carried out is very dependent on the setting. Third, whose role is it to carry out case management? Is it a title, such as a case manager, or an activity of a social welfare officer, social worker, or parasocial worker, or all of the above? Who is qualified to do the work, and what type and level of training is needed? This webinar will address these 3 areas and a few more. So our first speaker today will be Andy Bilson. Andy started work as a child care social worker in 1972. He managed offender services and campaigned nationally on juvenile justice in the UK. He was a senior manager in various NGOs before becoming a social work academic in 1990. He has been involved in consultancy internationally since 1996, when he was the director of UNICEF and the Council of Europe's Observatory on European Children's Rights. He has worked in many countries on the
All right, we're having a bit of a technical difficulty here. Let's hang on a moment as DC works on their microphone problem. Thank you. Okay, it's possible that DC's computer crashed, something like that, or their connectivity crash, something like that. So they are attempting to log back into the webinar. So I want to thank everyone for your patience. Yeah, Andy, if you want to go ahead and begin, that's probably a good idea.
Okay, I hope you can hear me. I'm talking to you from what's increasingly becoming a snowy UK here in the north. and I wanted to tell you about a study that I've recently done called Making Social Work Work, which was done for every child. It's a study of over 350 papers, and we focused down onto 163 papers on social work with children and families. Amongst this, we were looking at 62 which were published through peer-reviewed journals, and a number of others that were policy and practice papers. We also carried out focus groups with 25 staff from every child who was sponsoring the research, and they work in 13 countries around the world. The paper was covering how social work operates with vulnerable families and children without parental care in resource-constrained countries. Mainly papers we looked at came from Africa, from South America, some from the Caribbean, and some from countries of the former Soviet Union in Central Asia and Eastern Europe. So the key findings of this paper were that we saw four major types of approach to providing social work, and they're listed here on the slide. I'm going to concentrate on casework and case management because those are the topic of today's presentation, but I'll also briefly mention the others. So casework was seen as the traditional social work approach in which a qualified social worker directly provides psychosocial support and also develops case plans, and that includes developing programs, trying to ensure that policies focus on protection, care and healthy development of children. And within this casework approach, the term case management is also very widely used, and it refers to the responsibility for coordinating and controlling all the professional aspects of the social work program for a particular child or family. So this is where one of the issues about case management and the confusion about it can come up, because it's used in many, many different settings and in many different ways. The second approach, which we've called case management, here refers to management within a market model. In other words, in these situations, the case manager is actually the purchaser of a set of services which are provided separately. Usually within a case management approach of this sort, there's a separation between the purchaser of services and those who actually provide services. The case manager carries out assessments, which is the main social work task of case management in this sort of role, but then also finds the appropriate care services for the families, works out a care plan, manages budgets, rations care according to policy guidelines, monitors outcomes, and understands the market of services, knowing best value and practice. Now this is an approach that's been widely proposed, and I think has a number of issues for resource-constrained countries. The issues in particular are that you need a purchasing organisation. It requires many budget reforms so that all the public funds for social services are in the hands of the purchaser. There needs to be a strong market in which service providers compete to provide a range of services. And all of those things require a lot of reforms to many of the systems. You see it quite often in my work in Eastern Europe and Central Asia. Countries are trying to move towards this approach. However, there are many, many problems. I think one of the issues here is that it takes a particular philosophical position, which is that that a market is the best way of providing services, and I'm not sure how relevant that is to many countries where markets are not well developed, where that's maybe not the main way of providing services. The third approach to social work is around community engagement. And this is where the social worker, rather than working with individual cases, works with communities, and quite often works through community child protection committees and other such organisations. So, for example, in Sierra Leone and in Namibia, there were reports of foster care programs being managed by community child protection committees. And the final area is social protection. Social protection is the provision of cash transfers to actually support children and families. It's very strong in that sorry, people are asking me to move to the next slide, and the next slide is a different topic, so I'll carry on with this one. It deals with cash transfers so that families are supported in financial terms, and alongside this, social work actually provides support for families to develop welfare. It's used in many countries. So, for example, Temin in 2008 did a study of these approaches in Ghana, Malawi, South Africa, Uganda, Ukraine, Brazil, and Chile. The strong points are that it does directly address issues of poverty. Some of the points where there are issues are that it can, for example, bias the workload of social workers. So, for example, in South Africa, it was found that one aspect of social protection that imposes an enormous workload on social workers is foster care grants to relatives, which has large amounts of bureaucracy tied up with it. It actually brings children into state care in order to receive money, and therefore has all sorts of other aspects of rights issues. Temin suggested that there's a risk that the enthusiasm about cash transfers detracts attention from social services and can lead to lost opportunities to strengthen the capacity of delivery systems. So on the one hand, it's very strong in providing direct support for families who are very poor. On the other, there are some issues about whether or not it actually detracts from other support for children and families. Within the 4 approaches, we found 5 basic functions. First of all was support and care. This is a traditional part of social work with children within the care system. It's providing psychosocial support to promote and support the child's social and emotional development. It's also encouraging and supporting child participation in decision making and planning, supporting carers to provide effective childcare, preparing children and families for children to return home, and preparing children for supporting them in independent living. So that's the first of the functions. The second function, protecting children from harm, is obviously very important. However, one of the issues here, and this is an issue more generally with some of the approaches to social work, is that there are warnings against taking too Western approaches. In the West, large amounts of effort go into child protection systems which deal with very large proportions of the population. For example, a recent study in Australia found that almost 1 in 4 children in southern Australia, 1 in 4 children in southern Australia were investigated before they reached the age of 16. So Lafell, who did a study on this, suggested that there was a need to approach Western approaches with care, and approaches such as reporting and registration can actually be problematic. So, for example, reporting and registration, she said, will be at best an expensive source of false reassurance to the public and decision makers, and at worst a source of increased vulnerability of children whose abuse is exposed without the necessary protective elements being in place. These things need to have quite a chunk of resource to be able to operate in a Western fashion. The alternative is to use things like community-based child protection committees, where support is provided to children through the community, and also for social workers to be very much involved in research and in awareness raising. The third area, gatekeeping and care planning, is around the business of trying to make sure that children don't unnecessarily enter institutions or be removed from parental care, and that once they do, to try to work to ensure that they can be quickly returned home. So Namibia have, for example, looked at this, and one of their papers issued by the Minister of Gender Equality and Child Welfare in 2008 said, quote, "More problematic is case management by social workers once children have been placed in the homes. Children appear to be permanent residents, and they have limited contact with social workers. In many homes there are no care plans for the children, and the placements are not periodically reviewed. Estimates by managers of some homes suggest that between 25% and 35% of children have been inappropriately placed and could be reunited with their families." So gatekeeping is about trying to make sure that children are supported instead of coming into the care system, and it's also about ensuring that once a child is in the system, work is done to get that child back home. Dunn and Parry Williams looked at South Africa, and they there found that this sort of work was going on, and were able to suggest that this led to a lower level of children being in institutional care. A fourth area where social workers are commonly involved is around actual development and management of services and in quality control. So here their tasks involve a range of things, from actually defining and setting up services, managing those services once they come into being, and in other cases developing standards for services and monitoring those standards in a range of settings. The fifth area is supporting paraprofessionals. We've already heard this being mentioned, and a paraprofessional, just to give you a quick definition, all use social work methodology to educate previously untrained community workers in skills that go beyond visiting and home care tasks, to include some assessment, support and referral to other services. In each case, the workers complete an established set of training experiences along with supervised practical experience commensurate with local laws and practices. Ongoing quality improvement, technical assistance and periodic additional training follow this initial training. So this was a definition that came from a study of paraprofessionals being used in Tanzania, Namibia, Ethiopia, Nigeria, Vietnam and India. So you can see it's a wide-ranging use, and it's a way of multiplying the resource of social workers who can help to carry out that training. I'm now going to move on to some issues that were raised by this study, and the first concerns the level of social work provision. in many parts of the world across Africa, there are problems of capacity. There are too few social workers to be able to provide the level of services that are required. A study in the Caribbean by Ken outlined this and suggested that during their assessments in all countries, there were only between 2 to 85 government social workers per country working on childcare and protection caseloads. And in some cases, this was as high as 16,000 cases per social worker per year. The other issue around this is the issue of human resources. For example, in many parts of the world, social workers are on low salaries, they have very poor working conditions, they have a low status, and social work isn't a very well-defined process. The second issue I've already referred to a little, which is that there is a dominance of Western models of social work. And one of the big issues in the debate in the literature is whether or not there's a need to develop local models of social work rather than just taking on board Western ones, which are often not designed either for the local culture, nor are they specifically designed to meet the particular problems and needs of different countries. So there's a real issue about making sure that local models of social work are actually developed. But at the moment that's a continuing problem. I've already referred to the third point, which is around protecting children from harm and exploitation. And again, the issue there is often one of Western models being inappropriately imported, but rather than ones based on what the local needs and the local risks to children. The fourth area that was around was that there was so little written in the social work literature for children working with children and families about child participation. It's an important issue that children should participate in these. So, for example, there was a number of studies of children who were moved to families because of to live with other members of their family because of being losing a parent, and often they were not even given a choice in which family member to go to. So some basic issues about that. A fifth issue that came up a lot in the work was that there was no focus on prevention. A lot of social work is dealing with crises, and the underpinning problems that lead to those crises are rarely addressed. And finally, and I think this underpins a lot of the other issues, is that a lot of the research that's around is international research or is based on countries with long-established social work provision. So there's a lack of local research, and this is particularly important if we want to develop non-Western models and to develop systems that actually work well in local settings. So that's a very quick run-through of the research. I saw one or two questions coming up, so I'll stop there for now and let you ask.
Okay, thanks very much, Andy. And what we'll do is, if you have questions for this, if you could write them in the chat room, and we'll try to get to as many as possible in the next 10 minutes. And we're going to start with one that goes back to a point, Andy, you were making on the slide about the 4 approaches. And it's really about, could you define the market model again? And then secondly, is this market model the best way of providing services. So let's start with that one, Andy.
Okay. The market model is something that's come very much from a neoliberal perspective. It's around the notion that that services are more flexible if they're not provided by the state, and that what should happen is that there should be what's often called a mixed economy, an economy of services which are provided by NGOs, by private providers. And in the market model, a case manager has a budget with which he can or she can purchase services. They purchase those services from an array of service providers, who some of whom may be other people in the local authority or the government, but others who will be in NGOs and private providers. The idea behind it is that competition between all those providers will push up the quality of services and push down the costs of services. So this is very much about capitalist model of social work provision, and it occurs in many different sorts of settings. That we'll hear later about case management in the States. One country where I see it working very well is in Sweden, where you have very high levels of state funding, which is provided to people through a case management approach, and where there's services are actually where the services are actually then purchased. It's not necessarily privatized, because those services could be provided by an NGO. They could be provided by government, but it will be a separate part of government. They separate out the purchaser of services and the service providers. Now, for me, the issue about case management is that it runs on a set of assumptions which I'm not necessarily sure I agree with. It assumes that this sort of market is the best way of actually producing high quality services. And it also leads you into a whole set of issues about having to have substantial budgets. It means that you have to have a whole system to separate out the purchaser from the provider. And in many countries where I work, these things are just not in place. The NGO sector itself is either weak or very, very wary about the state and its involvement. And in those sorts of situations, where there isn't a big central state purchasing of services, I'm not sure that case management of that type is useful. The rationale is this one of saying that in places like the UK, where until about 15 years ago, maybe 20 years ago, everything was provided through the state, the idea was that it would make things more flexible and would lead to better and cheaper services. I'm not sure that that's a good thing in countries where there isn't a lot of opportunities to provide NGO sector services.
Okay, Andy, thank you. And we've had a chance to address that question around both the kind of market approach and what that means, and a little bit of the reasoning behind it, as well as the case management and casework kind of issues. There are some other questions that we didn't get to here, and we can get to them later on ovcsupport.net. And/or Andy, if you have any comments, you could write them in the chat room as we go on to the next speaker, which we'll do right now. And we're going to have Amy, who will introduce Keetie, who's the next speaker.
Thanks, Jim, and thanks so much, Andy, and everyone for all of your good questions, and especially to Andy for jumping ahead and presenting as we were experiencing technological difficulties here in DC. So I'll continue with my introduction of Keetie. Our second speaker now will be Dr. Keetie Roelen. Keetie is a research fellow at the Institute of Development Studies in the Vulnerability and Poverty Reduction team, and she's a member of the Center for Social Protection. Her research interests include the measurement of child poverty and vulnerability, social policy evaluation, and linkages between social protection and child protection. She has extensive experience in working with international organizations such as UNICEF, World Bank, and UNDP, performing research and policy advice work in Southeast Asia, Africa, and Central and Eastern Europe. She has designed and delivered lectures and training courses for master's students, professionals, practitioners, and policymakers. Recently, she was part of a team that led a mapping and documentation of referral mechanisms and case management programs in Eastern and Southern Africa. She'll talk with us about the findings of this study and the potential of case management to respond to the complex needs of children and families. Keetie, go ahead.
Thank you, Amy, for this introduction. And yes, so as you said, in the next 10 to 15 minutes, I will present the preliminary findings of this study on case management and referrals for vulnerable children in Eastern and Southern Africa, which was a study commissioned by the regional office of UNICEF in Nairobi. And before I start this presentation, I would also like to acknowledge my other two team members in this, Sean Long and Jörg Redstrom, who have been working on this study together with me. Sean has also joined this webinar, so in the Q&A session, I hope that she can also respond to some of the things that may come up. So just to briefly outline what this study was about or is about and the process of the study. We started last year in August, September with a desk study, which was the first component and resulted in a large stock-taking report encompassing a literature review looking at the documentation available in the region as well as wider literature, but also including findings from a large range of telephone interviews that we've done with stakeholders across the region. We then went to 3 different countries for country case studies, namely in Tanzania, Mozambique, and Namibia, to test some of those findings that we found in the desk study and to get more in-depth insights. And as Amy mentioned, we are currently working and drafting the final report, which will compile the findings of both the desk study as well as the country case studies. And the overall study really links to a lot of things that Amy has pointed out in the introduction, as well as the issues, the challenges that Andy has just referred to. But in this presentation, I will focus on issues around particularly roles and responsibilities in terms of case management and referral services for vulnerable children in Eastern and Southern Africa. And then maybe if there's time in the Q&A session after this presentation or after all presentations, we can broaden the discussion a bit. So we just heard Andy's presentation on case management and the 4 different distinctions, also with respect to community engagement and social protection. So hearing that, I thought it would be important to highlight what we mean with case management, or how we thought about this throughout the process of the study. And this slide depicts the process of referrals and case management for vulnerable children and the various steps that we felt this study should consider to look at the whole process of case management. So it goes right through from identification of vulnerable children through to the assessment of their needs, then the referral to appropriate services, and follow-up or redress, which could then provide feedback loops back into new assessment of their needs and potential new referrals or follow-ups with respect to services. And across all those steps, tracking and monitoring is an important issue. Now, just to clarify, because we've just had a discussion about the market model, we did not necessarily separate functions with respect to purchasing care and support and provision of care and support. As Andy pointed out, it's very much context specific to what extent this works or not, or such a market model is in place. And I don't think that the region that we're looking at, this is very much in place and is a distinction that's widely used. But we may come back to that a bit later. Okay. This slide about linkages points to one of the, I would say, one of the main findings really of our study, or lessons learned, which is about the fact that there is really a need for stronger linkages when we talk about providing a comprehensive response to vulnerable children. And this is a need for linkages both horizontally as well as vertically. So there's a need for linkages between services or between sectors, as well as from the formal to the informal sector and vice versa. And unfortunately, across the region, we found that there is a lack of such clear linkages and collaboration and cooperation to follow that. There are a number of positive examples that we found. For example, a memorandum of understanding between ministries in Namibia to improve coverage of birth registration. Also, we saw collaboration between neighborhood care points and health workers in Swaziland to link up health care for children. And we've also seen some more informal collaboration, for example, in Tanzania, where there are regular, say, monthly meetings between health workers and child protection workers in different sectors to link up and discuss different cases. However, overall, such positive examples were considered to be limited across the region, and illustrations of limited cooperation or where there is tension between services seem to be more reflective of the current situation. So, for example, we heard from Lesotho's experience in cases of child abuse, where there is limited cooperation between police, the child helplines where the case of abuse may be identified, and child protection to link up different services in support of children being faced with abuse. This refers to the horizontal linkage between services, but also we found that in Mozambique, for example, looking at the linkages from the formal into the informal sector, that the child protection community committees that Andy just referred to and statutory district social welfare workers, that link was quite difficult and also very much dependent on the particular district or region that we were looking at. Roles and responsibilities were not very well defined, and both community workers as well as the district social welfare workers or technicians didn't quite know who was responsible for what. So based on this finding, and also other findings obviously, this study very much suggests that there is a need for a focal person to coordinate and have that responsibility to provide a comprehensive response for vulnerable children. And in many ways, the different bullet points presented here with various functions refer to or resonate with the functions that Andy has just lined out. But I also want to emphasize that it is not our aim to put forward a specific model for case management for Eastern and Southern Africa, for the region as a whole, or to suggest that maybe more individualized models or Western models of casework or case management as we know them would be preferable. But one thing that we did find when going through all the documentation and talking with stakeholders over the phone and in countries is that whoever takes on this responsibility, there needs to be a focal person that is the main point where these different responsibilities sort of sit, so that there is oversight and there is actually scope for coordinated response. And I don't want to go into all the points that are listed here, but maybe pick up on some of the bullet points. So, for example, when we talk about being aware of prevention, response, and redress or follow-up, this very much links also to one of the challenges that Andy mentioned, and that's that across the region we found that there is a very large focus on response and reactive provision of services and referrals rather than acting preventively. And we felt that having that awareness is really one of the key issues that would be part of that focal person. Similarly, we felt that the identification of vulnerable children was still very much limited to, say, the more obvious cases of vulnerable children, and that more complex cases were either not being picked up on or their needs were not being assessed properly. Fortunately, we also saw some positive examples here where various tools for identification are being developed and piloted across the region, such as the Child Support Index that's being fielded in Ethiopia at the moment, and also where there is potentially more space for self-referral mechanisms such as child helplines in, for example, Zimbabwe and Namibia. Well, as said, our purpose is not to point towards a particular model or say who exactly should be that focal person. We feel that's very much dependent on the particular context that we're looking at, and that this may be a social worker or a paraprofessional, or even it could be a role for the community committees. But then when looking at these particular functions within case management, what are some of the practical and logistical constraints or challenges that that those workers face? And to highlight that, I put a picture on this slide of Ivan, who is a social technician, a district social worker in Kisanga district in Cabo Delgado in Mozambique. And he's sitting in his office behind his computer, and in some ways this is a good reflection of some of the practical challenges he faces in doing his work, because as he was sitting there, he wanted to show us the new database that was put in place for registering cases and to act as a monitoring system, but there was a fault in the system that prevented him from doing so, and there was no capacity at district level to solve that fault and for him to be able to work with the database. So the last case that he had entered was months ago because he couldn't solve the problem on his own. In a way, then that's an illustration of the issues that many social workers in Mozambique, but across the region, face. There is a diffused set of tasks, there's a high workload, and there's a limited set of capacities to do this. And as Andy also pointed out, many social workers also face a high administrative burden. We saw this also, for example, in Namibia and in reports on social work in Botswana. And these are countries where indeed social protection has grown rapidly and where many social workers have to deal with high administration of social protection transfers. But there are also other constraints with respect to workload in terms of the number of communities that also in this case Ivan has to deal with, and that there are just too many for him to interact with on a regular basis to really keep track of the various cases and the problems on the ground. that's some examples for the difficulties that social workers face, but community volunteers also face that challenges in being part of this in case management and referral systems for vulnerable children. Again, this is a picture from Mozambique, and this is the Child Protection Community Committee in Bilibite in Cabo Delgado. And although many of these committees and many community volunteers are at the forefront of the response to vulnerable children in the region, they face challenges in that there's not a clear division of roles and responsibilities, and that's both within committees, but to a greater extent between committees and other services that they would need to refer to, and those statutory services. But also it's a struggle for them to move beyond a response to material needs and to address more complex cases and complex vulnerabilities. As I just said, there is to some extent there's limited awareness of child protection, of more complex issues and how to deal with them, and also what the appropriate services are and where they are to refer children to. Very practical challenges that many of these community workers face is that there's no transport, or that they have no resources to really respond to children's needs, whether that's material in terms of the provision of food or clothing or shelter, or non-material such as psychosocial supports. So to wrap up, I just want to leave you with this slide on some of the points for the way forward and needs that we identified for the way forward. And in terms of the presentation just now, the third point is most relevant in terms of linkages and roles and responsibilities. And it alludes to the need of having clear mandates and protocols that stipulate the roles and responsibilities across services and between actors, so both between sectors as well as between statutory services and volunteers, and also something that I haven't spoken about, the NGO sector. The other 4 points refer to the other findings of this study and the other needs that have been identified. 2 of which are really underlie or are a necessary condition for those mandates and protocols, which are a national consensus on the value of case management, so that there is a sense of responsibility and an accountability framework across all services and all stakeholders that have a role to play in the response to vulnerable children, but also in having that common understanding of what case management and referrals actually mean and should do. And the final 2 points refer to 2 issues that we feel need to be put in place to make sure that this can all happen and take place in a sustainable manner, which is a monitoring and evaluation framework, also referring back to the issue of accountability and the need to mobilize resources to make all this happen. Okay, I would like to leave it at that for the moment, but I look forward to your questions.
Please go ahead and continue to write your questions in the chat room, and we'll invite Keetie to answer between 2 and 3 questions. And if time permits, you can raise your hand and engage your microphone. And we'll go back. That was just a question. We'll go back to the last slide as somebody asked to see that. Now, we'd like to start with a question about, Keetie, about how does the perspective you described in your presentation either differ or agree with the model that was described by Andy?
I assume that that refers to the model of the market model.
Yes, that was one of the points he was talking about.
Well, as I said in my presentation, this was not something that we used as say, a framework for thinking about case management to begin with. But also, having gone through the study and having seen all the experiences on the ground and also the way people think about case management, I don't think the market model as it was presented by Andy would work in this particular context for various reasons. One is the lack of services, whether that's private or public. This alludes to other findings that we came across in the study, is that we can talk about the case management model and setting up case management in terms of who has the roles and responsibilities, having a conducive policy environment, making sure M&E is in place, but all that needs to go hand in hand with services, and those services need to be there and they need to be provided in high quality. And in the particular region that we're talking about, I am not convinced that the market model is the right model at this point in time.
Okay, thank you. We have a number of other questions coming up. You know, are there any kind of models or lessons learned for supporting the sustainability of community committees that you could share with us? So it's really about any lessons learned about sustainability of community mechanisms.
Well, we looked into community, the role of communities and community committees, particularly in those countries where we did the field visits. And issues of sustainability came up in terms of incentives for community members, for example, as well as training for community members. And training was undoubtedly one of the important issues to make sure that the response is sustainable, in the sense that the capacity needs to be built within the community, across the community, to make sure that it's not limited to a few members, but also that there is this awareness about prevention, about more complex cases, about a response beyond material needs. The issue of incentivizing community committee members was less straightforward. It was felt that in some ways there need to be incentives, but how they would need to be put in place, there was no consensus about that. So whether that would be a financial incentive, for example, or not. It could be a strong incentive in terms of getting community members engaged. It could also cause tension within communities, particularly if there are other members being part of other committees in the community that are not related to child protection, but to other issues, and where there's no such financial incentives. But I see Sean has her hand up, so maybe we could give the microphone to Sean to add to this.
Yeah, we're having trouble finding Sean, so maybe we'll either come back to Sean for a contribution during the general discussion at the end of the after the next presentation, or also, Sean, you could I see you were struggling to switch on the mic. You could also write in the IM function, but if your mic is working, why don't we just say that we'll come back to you during the general discussion, and you can add what you want. We have one more question for you, Keetie, and it's really a combination. It's about the study itself. You know, could you clarify the purpose of conducting it beyond stock taking? What's the final use of it, and is it published yet? So it's just around the current status of the study.
Yeah, so we started this study last year together with UNICEF, the regional office of Eastern and Southern Africa in Nairobi, very much against the backdrop that multiple needs of children in the region are currently not adequately responded to, and that there is a role for case management and referral systems to play there, but also that we know too little about what is currently happening on the ground with respect to case management and referral systems. There was a feeling that there are a lot of initiatives, particularly at community level, but that we had too little of an overview of what that was. So that's very much the backdrop against which the study took place. We are currently in the process of finalizing a final discussion paper, which is a more succinct discussion of the main findings, and then there is a stock-taking report that is also in its draft form at the moment, which is a rather lengthy and very comprehensive document outlining sort of the background against which we frame the findings. With respect to what will happen with this study, I saw Nankali from the regional office is online and joined the seminar or the webinar. I'm not sure whether Nankali would want to say something more about this. I see that Nankali responded that the connection is terrible, so I'm assuming that that's a no for the moment, but maybe we can come back to that later.
Okay, thank you very much, Keetie. Nankali, just in case, recognizing that your connection is terrible, but if you get a chance and want to write something in the IM window, that would be great. And we're going to go ahead and move on to Chris Herman, and Amy's going to introduce Chris.
Okay. Thanks, Jim, and thanks, Keetie, for your great presentation. Our final speaker will be Chris Herman. Chris is a senior practice associate at the National Association of Social Workers in the United States and has her MSW and is a licensed clinical social worker. As part of the NASW Center for Workforce Studies and Social Work Practice, Chris develops educational resources, analyzes and develops policy, and represents NASW in multiple coalitions and projects related to case management, aging, and palliative and end-of-life care. Ms. Herman joined NASW staff in early 2007 with more than 10 years of professional social work experience in geriatric care management, hospice care, and chronic illness. Chris will offer some food for thought as she discusses the scope of case management in the U.S., definitions and standards used, and challenges facing the case management field as it has been experienced in the U.S. So while she uses the U.S. as an example of a country case study, what she raises may help us recognize some of the commonalities of the social work profession and the case management approach across countries, and also highlight some key differences. So thank you, Chris.
Thank you, Amy. And it's a pleasure to follow Andy and Keetie. Really enjoyed both their presentations. And as I listened, I was struck by the fact that in the U.S., social work case managers have faced, and in many cases continue to face, at least to some degree, some challenges similar to what Andy and Keetie described. So I appreciate the opportunity to describe social work case management in the U.S. as Amy said, is an example of what's going on in one country. And I'm going to begin with a brief historical overview. This is not advancing. Did I do that? Thank you. Which button do I need to hit? Okay, thanks. Sorry about that delay. We were figuring out I was figuring out how to advance the slides. Okay, so the practice of case management and the profession of social work developed simultaneously in the U.S. during the late 1800s and early 1900s. And this development was spurred by poverty and other social problems associated with growing industrialization, urbanization, immigration, and population growth. In response to these problems, then, charity organization societies and settlement houses, both of which originated in London, emerged in various parts of the U.S. And the charity organization societies really worked on a micro level. They were staffed primarily by volunteers known as friendly visitors, and they worked to identify and resolve the causes of poverty on individual and family levels. Some of the central features of the charity organization societies were assessment, financial assistance, service coordination, and the relationship between the worker and the client. On the other hand, settlement house workers strive to address social and economic problems on the group and community levels by working in partnership with their neighbors. And some of the characteristics of settlement houses were direct service provision in a wide variety of areas, including medical care, education, recreation, and child care. Also community organization, advocacy both on local and national levels, and research on social problems often done in partnership with academic institutions. So as you can see, the emphases of the charity organization society and the settlement house movements both differed from and complemented each other. And we see elements from both these movements evident in social work case management as it's currently practiced in the U.S. Though it's been more than 100 years since it began, case management remains integral to social work practice. In 2006, NASW did a study of licensed social workers in the U.S. So this wasn't all the social workers in the U.S., but those that held state licenses, and I'll say more about that later. And we found case management is a component of many social work jobs, and that significant numbers of social workers report spending more than half their time on case management responsibilities. So as you can see, it's very central to the profession still. And although NASW's focus and the focus of my presentation is on social work case management, it's important for me to mention that nurses and other professionals also practice case management and that we recognize the value that they bring to the field. In fact, we've collaborated with nurse case managers on multiple projects and initiatives. We've also seen in the U.S. that paraprofessional social service providers, we don't use the term parasocial worker here necessarily, but social service providers who have some training but not in social work specifically, and then peer counselors are beginning to play a role in the field of case management. So it's a pretty broad field here. This is still not working. Okay. Great. Definitions of case management in the United States have evolved over time, and I'm sure they're going to continue to be refined, but multiple definitions are used. NASW's Social Work Dictionary defines case management as a procedure to plan, seek, and monitor services from different social agencies and staff on behalf of a client. It goes on to say that case management limits problems arising from fragmentation of services, staff turnover, and inadequate coordination among providers. And I think these themes are pretty similar to what Amy and Andy and Keetie mentioned. I'm especially thinking of Katie's comment about need for horizontal coordination. The Social Work Dictionary goes on to say that case management can occur within a large single organization or within a community program that coordinates services among agencies. NASW's application for case management certification elaborates on this definition, stating that the primary goal of social work case management is to optimize client functioning by providing quality services in the most efficient and effective manner to individuals or families with multiple complex needs. And social workers use many strategies to achieve this goal, such as enhancing the developmental problem-solving and coping capacities of clients, linking people with resources and helping them navigate service delivery systems, improving the scope, capacity, operation, and effectiveness of service delivery systems, and creating new ones even, and contributing to the development and improvement of social policy. So here I think you see some overlap perhaps with Andy's casework definition. And I've included a link to the certification application I mentioned in the resources section at the end of the PowerPoint, in part because it includes competencies for social work case management that I thought might be of interest. And those slides will include other resources that I mentioned throughout the presentation, just to say that up front. And all of our PowerPoints, in case it hasn't been mentioned, will be available for you to download after the webinar and check that out when you have more time. So though I've been using the term case management, various terms are used in the U.S. to describe work that's somewhat similar. Some of these are care management, care coordination, service coordination, client, patient, or healthcare navigation. And similar to case management, there's many definitions for each of these terms and also different perceptions, about the distinctions between case management and the related practices. As an association, NASW hasn't attempted to make those distinctions. Instead, we use the term case manager, and we acknowledge that our standards for social work case management, which I'm going to describe in a moment, may be useful to social workers who have titles other than case manager, but who do similar work. And also, somewhat similar to what Keetie was describing about her study, we don't endorse necessarily specific case management models or programs. We recognize there's a wide diversity out there. While on the topic of definitions, I want to mention that NASW defines social worker as an individual who possesses a baccalaureate or graduate degree in social work from a school or program accredited by the Council on Social Work Education in the U.S. And this is important for us because there's a lack of federal title protection, so that perpetuates a lack of understanding about social work and of the psychosocial expertise needed to practice case management. At the same time, NASW recognizes that definitions of social worker vary in other countries and that individuals without social work or other professional training play an essential role in case management service delivery systems outside the U.S., as Andy and Keetie described and as we saw reflected in the poll at the beginning of the webinar. So I mentioned the standards. We developed these in 1992 to address case management as a specialty area within social work practice. And they're for individual practitioners, not for case management programs. The standards are designed to enhance social workers' awareness of the values, knowledge, methods, and skills needed to practice case management effectively. So the overarching goal is really to improve the quality of social work case management services and benefit clients who use case management. But another goal is to enhance public awareness, helping other service providers, employers, policymakers, and consumers understand the social work approach to case management. And NASW is currently revising the 1992 standards in collaboration with a group of 10 members, all of whom have expertise in different aspects of case management. The process includes a public comment period, probably beginning in early May. And I've included a link to the NASW webpage on which that public comment link will be posted in case you want to go take a look next month. So throughout the standards, the following characteristics distinguish the social work approach to case management. One, that social work case managers engage clients in all aspects of case management and tailor services to each client's needs, goals, and preferences. Two, that there's a therapeutic or working alliance between the social work case manager and the client that's integral to helping the client achieve her or his goals. That social work case managers understand each individual can't be understood outside the context of the social and physical environment. And Keetie mentioned the family, certainly, which is key to the person and environment framework, for example. But the framework also takes into account the effects of systemic injustice on clients, for example, the ways racism, sexism, other forms of social oppression limit clients' opportunities and perceptions. And the strengths perspective, that rather than focus on pathology, social work case managers elicit, support, and build on each individual's or family's strengths and assets, their resilience, their potential for growth. And that such assets can be interpersonal or naturally occurring within the environment or some combination thereof. That social work case managers don't work in isolation. We collaborate with other social workers, other disciplines, and other organizations to help clients meet their goals. And this is especially important given the gaps that we have here among service delivery systems, similar to what Keetie described. And finally, that social work case managers use a variety of approaches to effect changes in individuals, families, organizations, systems, communities, and policy, really intervening on multiple levels. The revision of our case management standards is timely because case management is getting quite a lot of attention in the U.S. these days as policymakers and payers look to coordination of services as a way to improve service quality and outcomes while also decreasing costs. But at the same time, there's a growing demand for additional research demonstrating the effectiveness of various case management models, of case management specific populations, and so on. And this can present a challenge for social work case management, which doesn't always fit easily into a scientific evidence-based model. And as Andy mentioned, we need evidence. Another challenge case managers face in the U.S. is deprofessionalization. For example, there's one program which is getting a good bit of funding and national attention, and it uses undergraduate college students, many of whom plan to become physicians, to do some of the work that social work case managers used to do in hospitals. In one article, the program founder described the challenge of finding resources for clients in difficult circumstances as, quote, a perfect problem for a college student, a really fancy Google search. The implication that only good computer skills are needed to do social work really underscores, in our view, the need for research demonstrating the value of professional case management and the lack of understanding about social work. I want to add briefly a word about licensure and certification. In the U.S., all 50 states and the District of Columbia license social workers, though not every social worker in every state is required to have a license. And though these licenses aren't specific to case management, each social work case manager has a responsibility to follow the licensure laws and regulations of the jurisdiction or jurisdictions in which that person practices. And nurses and some other professionals who practice case management are also licensed by state governments. And in addition to professional licenses, some social workers and other professionals who obtain certification in case management is one indicator of their expertise. Demand for this certification is growing among employers, professional associations, even consumers and accreditation bodies too. And though NASW encourages certification as an association, we emphasize that it's voluntary and it can't guarantee quality service in and of itself. So with that context, let's take a really quick look at where case management is provided in the U.S. Social work and other case managers operate across the public, nonprofit, and for-profit sectors and in urban, suburban, and rural areas. And the services may be supported by government funding, foundation grants, or insurance, which the insurance might be sponsored by the government or by employers, or people might purchase it on an individual basis. In some cases, such as geriatric care management and healthcare navigation programs, some of those programs, clients pay for their own funds, with their own funds for case management services. And that leads me briefly to the settings and specialties in which social work case managers practice. Those include child welfare and other services focused on youth and families, much of which we've heard today in Andy and Katie's presentations, but also aging and disabilities, healthcare and behavioral mental health care, correctional systems such as prisons, programs for employee assistance or housing, immigration and refugee programs, and services for veterans and active duty military. And the goals and functions of one case management program here can vary greatly from those of another, even if it's in a similar setting or specialty. So the last thing I'm going to mention is caseload and workload concerns, which Andy and Katie both referred to in their presentations. This is a really common concern in the U.S. as well, and caseloads here can range from single digits to hundreds, depending on the model and the setting. What I want to clarify is that when I say caseload, I'm not referring to every individual who gets services in a specific setting, such as a school or a health department, say, or a hospital, but rather to the number of clients that a social worker serves at any given time, not that they have the potential to serve. So the caseloads issue has gotten national attention here in recent years following deaths of several children in child welfare programs, and it's also a significant concern for healthcare settings. As an association, we regularly receive inquiries about appropriate caseload sizes for different settings, and as you can imagine, it's a question we really can't give one answer to because there's so many variables that affect the time needed to provide case management and the manageability of the case manager's workload. But there have been some tools developed to help case managers in specific healthcare settings address the issue of caseload size, and NASW's worked on one of those. I've included a link on the resource slide, and there's a matrix that mentioned in that link that may be useful in considering the variables that affect caseload size and manageability in your settings, although I imagine there will be some differences as well. So we also, just encourage our members and anyone else who calls to use our standards for case management or other standards of practice as they consider appropriate caseload sizes. And we assert in all our standards that organizations have a responsibility to help social workers establish and maintain workloads that enable effective service delivery. So my last slides here are just resources. This first one is all NASW resources. And then the second one from other organizations. The first publication, I believe, is more of a, if I recall correctly, a program level document, whereas the other three sets of standards are for individual practitioners. So thank you so much. I look forward to the discussion.
All right. Thank you very much, Chris. Why don't we go on and have some questions for Chris. Please continue to write your questions in the chat window, and we will invite Chris for the first two or three, so you might direct your questions at Chris's presentation, and then we'll move on there to any general questions or questions we haven't gotten to yet. So, Chris, we wanted to start with one question here, and that is, which competencies or standards that you mentioned might be appropriate to consider in low and middle income countries? So you were talking about it from a U.S. perspective, and then as you think about it, what might be particularly appropriate in low and middle income?
Sure, that's a good question, and I'd encourage you to take a look at both the certification and the 1992 standards, but even more when they come out at the public comment new standards, that to get some more information about it. We have a standard on cultural and linguistic competence, and Andy and Keetie both talked about the importance of that and programs being localized to each area or setting. And I think that though we're in different environments, those principles in that cultural and linguistic competence standard would be very similar in terms of just the need for an approach that's respectful and appropriate and so on. I'm thinking the assessment and service delivery, there's a standard on assessment, and then another standard on service planning, delivery, and monitoring that in some ways are the core of the standards, though not necessarily more important than any others, because they kind of get at the very action steps of what do we do as social work case managers. And those might be worth taking a look at, just for some sense of how we frame it, and see how they fit with your context. For example, the way we frame it, just out of respect for the diversity of case management programs, is that an assessment may include these factors based on where you're working, what your level of expertise or scope of practice is, what your client's needs are, what the goals of your program are, but we look at families and family systems, physical health and well-being, behavioral health and well-being, resources, of course, how we use our training as professional social workers in the process. For example, in the assessment, and the service delivery one is similarly broad, so if case managers can kind of pick and choose what fits for their setting. Some may be doing more counseling with clients than others, for example, or running groups, or others might be doing more community organizing. So they're very broad, at least in terms of the U.S. context, and those might be worth taking a look.
I noticed we did get a comment from Natalie Connor. Hi, Natalie. It says in here it might be helpful to delineate between types of case managers in child welfare. CPS, foster care, adoptions, post-care. Any thoughts about that?
Yes, absolutely, and we could do that for any of the other contexts as well. I couldn't agree more, Natalie, and just in the interest of time I didn't, but there are absolutely multiple settings and service delivery systems within child welfare, And we could say the same about the healthcare system, or the behavioral healthcare system, or really aging, certainly. So that's an excellent point. Thank you.
Okay, I think what we'll do, if you, again, have any more comments or questions about Chris's presentation, you can write them in. But what we'll do is go more to the general discussion and questions about any or all of the presentations. And we wanted to start with the one, is it that one? For Andy. Pardon me? For Andy, you know, I'll read the comment that came earlier. It says, while I, to some extent, agree with the finding that there is limited child participation, I hold the view that this is exaggerated and doesn't appreciate local traditional channels through which child participation is fostered. Please, can you comment? And this came from a participant in Lesotho.
Okay, I'm happy to comment on that. What I was talking about was what I was finding within the literature of these hundreds of papers that I looked at. And there, in that literature, there was very little written about it. I'm pleased to hear that it's the case in Lesotho that there is good engagement, and it's certainly been the case that I've seen this in many of the social work programs and projects I've visited. What I'm commenting on is the lack of any attempts to write about it in this particular context. It's written about a lot elsewhere.
Thanks for that one. We'll go on for Keetie. This is a question for Keetie. Between the social worker and the community worker, who is best placed to lead case management, and is there another alternative?
Thank you for this question. Before responding to that one, I also would like to say something to the question about child participation, because I am very happy to hear that there have been positive examples in Lesotho, where the comment came from. But we also found actually very limited child participation in terms of the identification and assessment of needs, and actually went as far as to devote a separate section to the issue of including children's as well as their families' voices in the process of case management and referral services, because we felt it was not emphasized enough. And in all the discussions, or the majority of the discussions we had with stakeholders, it was highlighted that there was too little space for children to express their needs, and then if they do, for them to be taken seriously. So I just wanted to respond to that question as well. In terms of the question who is best suited to step in, and whether that should be a social worker or a community volunteer, I don't think there is a straightforward answer to this. As I said, that depends very much on the context and also on the particular capacities at either end. The social worker, so the statutory services, as well as on the community end. But we could also think of intermediate solutions such as paraprofessionals, for example. That said, we do feel that the person with that focal person having those responsibilities is probably the person is probably better placed if it is a statutory worker, because with that level of responsibility and have for that person to be held accountable to taking up such responsibilities, there's questions around the extent to which you can expect such responsibilities from community volunteers, which is also something that we discuss in our study in more detail.
Okay, thank you, Keetie. Just had a question that goes back to Andy, you know, just kind of maybe a quick summary of what you think the advantage of case management is over casework, And as a comment came in, it said it creates a conflict in the social worker who on one hand has to provide for all family needs, but at the same time has to consider the needs of all other clients. So that was the sort of general question. We thought you could maybe say a few words about that.
Okay. I think casework does involve case management, but it's the distinction I was trying to make was between a specific case management, which is within this market setting, and the case management of social workers who handle the very complex situations around a particular case. The case, I don't think there are massive positives for case management within settings where there are limited resources. I don't think it actually works well in those situations. The countries where I've seen them trying to implement it, which include places like Bulgaria, Kazakhstan, Ukraine, where there's a large state centralized provision, there's some advantage in trying to make sure that services compete on cost. But in fact, what I see frequently is that they don't, that the institutional care is paid for directly by the state, but other services have to be paid for from budgets, so there's an incentive not to use them. So I'm not promoting it as an approach, it was just one that I found in the literature.
Okay, thanks much, Andy. And I think what we'll now do is we had a request, I think it was during Keetie's presentation, about whether Sean had anything that she wanted to add to that, in particular around sustainability and casework. And so, Sean, I think your microphone works, and why don't you go ahead and turn it on and go ahead and respond. We were on. Okay, so still having a problem with the mic, Sean. Maybe you could kind of type in your response, and what we'll do is ask a few other questions in the meantime. We should also ask, as you are thinking about it, what are some of your experiences been with case management in your programs, and any successes and challenges? Again, if you've got some time, you're in a group, you could discuss it, but in the meantime, if you have anything that you could write in the IM window, that would be helpful. And while you're doing that, are there any other questions that we would?
Okay, is that working now? Hello? Seems to be working? Okay.
Yes, it is. Go ahead.
Finally, sorry about this. The point I just wanted to add to what Keetie already said about sustainability is it's a question that came up quite a lot while we were doing the field work. How can you do this? How is it sustainable to have some form of multi-sectoral coordination at a local level? And I think the point we need to make is that looking after children, child well-being, child welfare does have a cost, and I think we need to shift the debate to providing a robust evidence base to show that there must be a minimum level of allocation to get people to meet, and to have some mandated requirement to share information across different sectors. And we can't only leave it to community workers. We can't expect that to actually lead to the results that we want. I was in Namibia recently, and one of the comments was, well, we won't be able to meet because we can't have a budget, but if we give people the small amount of money to get local government workers to meet once every 3 months, then we won't be able to do the work because that's too big a budget. It's not actually that big a budget, and I think we need to shift the sustainability debate into more of a cost-benefit sustainability debate.
Okay. Thank you. And we do have a question for Chris that has come up while you were providing your response, Sean. And the question is, what's the standard caseload in child welfare, i.e. children, social worker, child protection, and what are the issues to consider in establishing a standard ration? So, Chris?
Sure. I can speak to the issues to consider. I can't speak to the standard caseload question, unfortunately, partly because that's very different from my own professional background and not what we looked at in the caseload work group paper when we were focusing on healthcare settings. But even if that were my background, I think it really might vary depending on where you're working. You know, as somebody made the point earlier that when you talk about child welfare, you're talking about foster care, child protective services, a whole host of different settings that address those concerns. But I can speak to some of the issues to consider in establishing ratios. One is the organizational mission. What does your organization or program want to achieve? If it's, you know, if the goals are more discrete, then possibly you'd be able to work with a larger number of people than if they're very, very broad goals where you're trying to address multiple aspects of people's lives and connecting with multiple types of, or provide multiple types of services yourself. The funding source and what it, you know, what kind of accountability there is to the funder. If, for example, if a government or a foundation has provided a grant for a specific program, what kind of reporting back is needed to demonstrate accountability for the use of those funds? Or what kind of work is needed to secure funding for a program? That can make a big difference, and sometimes case managers are directly involved in that. Certainly the complexity of the client's needs and their goals that you're trying to address. Also the availability of administrative support, access to technology. Technology, in my experience, and I think that of many other social work case managers, can save time, but it can also create time demands, especially in terms of introducing new technology and learning curves and so on. And I mentioned earlier the amount of documentation needed. Some case managers provide supervision, so if they have those kind of responsibilities, that needs to be taken into account. So those are just a few.
Okay, thank you, Chris. Yeah, and I think there's a you know, another issue that was a perspective particularly helpful here in the U.S. and that there's another factor that you mentioned around funding, and part of this is what are the resources available in various countries and the context that people are or the challenges people are facing around funding and resources. The other issue I think is that's becoming increasingly apparent is what's the relationship between the formal health, social welfare workforce, those people that are hired, that are social workers or have some kind of certificate in social work, and then how do they interact with the kind of informal resources, informal help that goes on at the community level that people have alluded to during this webinar. So I think that we're moving towards this. We have about 5 minutes left. We've had a number of really good questions and some responses and some written-in responses, and we appreciate everybody's participation and want to thank everybody for doing that. And we have a couple of more questions that we didn't get to that we often try to follow up with on ovcsupport.net with some online discussions, and we'll do that this time too. But we would like to have some closing remarks from Amy, and then Maury is going to say a few words, and we'll close for the day.
Well, we hope that these presentations and all of this discussion has offered some food for thought. And as Jim just said, that a lively discussion will continue on ovcsupport.net. We'll have, everyone can comment there, and the presenters can also continue to address some of the questions and really have an ongoing discussion after this. I think it sounds like from everything that's been discussed today, case management in the settings where we work is still very much being defined. And we can continue to work towards finding this fitting terminology for this system for delivering services to children and families in a coordinated way so that a full range of needs can be met. Today we've looked at some different definitions of case management, some reasons why case management is used, like for planning care, for coordination of services, and collaboration between agencies or organizations, looking at issues of continuity of care. And then we've also covered other topics like community engagement and caseload sizes and funding and resources for case management. So it's really a great and full discussion, and again, one that I encourage you all to continue. And this is just one first step and some food for thought and hopefully an ongoing discussion. So thank you very much.
Thank you so much, Amy, for chairing our session today. Thank you to Andy and to Keetie and to Chris and to Jim, who moderated our questions, to Sean, who was able to provide additional information, to all of you who had such excellent questions. And we did note that there was a final, just really I think, very insightful question about whether case managers should be social workers. Again, this has been a very rich discussion, and I think it could continue. We have been keeping track of all of your questions. We will put those on ovcsupport.net as soon as possible, either today or tomorrow, and encourage our speakers to log on to ovcsupport.net to offer some ideas, some responses, but also want to strongly encourage all of you to log in as well and to continue to engage in this discussion. It's one that I've really been looking forward to, so I'm glad that we were able to at least start the discussion today. Before we conclude our webinar, I just wanted to end with a few short announcements. We wanted to let you know that the Alliance will be hosting a think tank session at this month's 18th National Conference on Child Abuse and Neglect, Celebrating the Past, Imagining the Future, which is organized by the U.S. Administration for Children and Families in Washington, D.C. The Alliance will also be speaking and organizing several breakout sessions at the Child Protection Systems Conference to be held in Dakar, Senegal in May 2012. And finally, we'll be making a presentation at the International Federation for Social Workers 2012 Joint World Conference on Social Work, Social Development 2012, so Action and Impact in Stockholm, Sweden. That will be in July. And we're hopeful that some of you might be able to join us for these events. In addition, if there are other events or opportunities that any of you all would like to announce, please let us know, and we'll do that through the listserv and on ovcsupport.net. At this point, I would just like to remind everyone once again that a summary, PowerPoint presentations, and a recorded version of this webinar will be available on www.ovcsupport.net, we hope by next week. And if you are not on our listserv already and would like to receive information about future webinars and other relevant activities, please send an email to swws.webinars@capacityplus.org. Our next webinar session is tentatively scheduled for June 2012. We have a few suggested topics, and we're in the process of trying to figure out which of these is most feasible and interesting. One topic that comes up again and again is the issue of financing, and how do we determine what are the costs of the social service workforce and how do we finance it. If you have any information about this particular topic or other topics that you think that we should be addressing, you can let us know through the listserv address that I just gave you. If you would like to make a presentation on that topic or on any other topic, you can also let us know through swws.webinars@capacityplus.org. So, thank you again for logging in. It's been an exciting 2 hours, and we look forward to talking to you again in 2 months. Thanks, and until next time.
Thank you, everyone.